Tonight, we also look at the current situation and symptoms, what they mean for the president's health and his campaign. Our KION's Josh Cristianto joining us live now in our Digital Operations Center. Josh.
Well, Veronica, I'm told this is an unprecedented situation. A sitting U.S. president faces a serious health crisis just a month away from the presidential election. But the political analyst I spoke with actually says we should expect a vote on November 3rd. To say we're going through history, unfortunate in this case, wouldn't do justice to what we're seeing right now. If 2020 wasn't tumultuous enough, a sitting U.S. president now sits sequestered away in a hospital tonight for a virus that's brought the world to its knees.
We can talk about other presidents that have been disabled, but this particular timing and situation is very unusual.
Monterey-based political analyst Dr. David Anderson says there's typically October surprises right before a presidential election. Never has it directly involved the president's health and his capacity to campaign. There's also the question of what happens should President Donald Trump's health deteriorate. The emergency department director at Salinas Valley Memorial says these next few days are critical based on what they are seeing here.
The vast majority of what we see in the hospital here are patients that have been diagnosed with COVID, and then they come back about 5 days later, 5 to 7 days later, with worsening symptoms.
That could include pneumonia and difficulty breathing, where a ventilator is required. But fortunately, the president's early treatment with an experimental drug therapy followed by known antiviral remdesivir could keep those symptoms from getting worse. The president, however, at 74 years old, is in that high-risk category that would normally concern hospital staff.
That's where we see patients that come in that do have worsening symptoms. They are older, sometimes have multiple medical problems, so it is a little high risk once they're in that age category.
Right now, President Trump is said to be working from the hospital. Anderson says the U.S. government can still function smoothly with an incapacitated president and believes even then Trump will maintain power. And as far as the election goes, he believes this crisis wouldn't sway anyone to vote differently.
There are very few people out there still to be persuaded. Most people know how they're going to vote one way or the other, and many people are already voting.
And Anderson urges the public not to believe everything they read on social media regarding President Trump's COVID battle. He also hopes people see this and be more vigilant in their own lives during this pandemic. Veronica.
Good reminder, Josh. Thank you.